Right. Good evening, everyone, and welcome to this month's Deaf Health Talk about healthy aging for women and those who love them. The Deaf Health Talks are a virtual monthly community health education for deaf and hard of hearing members. Each month, the Deaf Health Talks is hosted on Zoom, where we cover a variety of health topics. So if you're interested in receiving information about our upcoming Deaf Health Talks, please sign up to our MailChimp, which we will post down in the chat box below. The Deaf Health Talks are also possible through the efforts of many people and organizations, including University of Michigan Department of Family Medicine, the MDisability Program, Michigan Deaf Health, Partners in Deaf Health, and Michigan Medicine Interpreter Services. This event is captioned, and we encourage you to ask our presenter any questions you may have using the Q&A box down below at the bottom of the screen. We will have a dedicated Q&A portion towards the end of the talk for around 20 minutes. Without further ado, I'd like to introduce our presenter for this evening, Kimberly Telstone. Kim is a healthcare provider for women and individuals assigned feminine at birth. She is strongly motivated to provide inclusive, accessible healthcare for all of her patients and their families. Influenced by spending over 25 years in sign language interpretation, she continues to maintain a strong focus on clear and accessible communication in healthcare. Her professional roles also allow her to advocate and educate future providers on aspects of risk assessment, sexual and mental health, reproductive justice, and the importance of consent in healthcare interactions. And with that, I will hand it over to you, Kim.
Okay. Hello, everyone. So this is a new experience for me to present. I have presented on Zoom before, of course, but with the audience, being so unknown, I don't know who's out there, who's watching. So that's a bit interesting, but I'm really excited about your questions that you may have after my presentation. And so I have a couple topics tonight that I want to address, but I want to keep it light. I'm going to touch on the top 10 things that you might be thinking about when you get into an older age in life. And my topic is in aging for women. I am a midwife by trade, and I have trained to care for women across various gamuts and people who were born female. So that means maybe that person, their current gender is not a woman. Maybe they consider themselves a man, or they don't have a gender identity that aligns with female. And I respect that. People who are born with uteruses are the people I provide care for. Some midwives also take care of people who are trans women, and they give medicine such as hormone injections, etc., to support their gender affirming care. So that's both for trans men and trans women. They provide medicine for them. And I'm a midwife that's not only focusing on babies. We also care for people all across their stages of life, from young to postmenopausal and elderly. Okay, I'm going to share some slides with you while I present. And my goal is to show the slide and then provide a brief description, and then kind of do that for the rest of the presentation. I'll do that now. Okay. So tonight, I want to share some information, answer questions, support your healthcare needs, your healthy things, and maybe give you some new ideas as well. So I used to be an interpreter. I still am an interpreter, kind of, but not practicing, not often anyway. And I do some teaching. I also have a degree, a doctorate degree in nursing. And as I mentioned, I am a midwife, and I've been practicing for 5 years. I really value health for my people, for my patients, and I am involved with supporting people, interpreters who provide care as well. I have found also that in my practice and meeting people on a daily basis, meeting my patients of different backgrounds and cultures, etc., my experience so far interpreting has been really amazing because I understand the language and interacting with people through discussions and communicating with my patients. And those who may depend on interpreters, depend on spoken language or different languages. Maybe they don't have a strong grasp on English as their first language. So I find that they tell me that they understand me well, and that's always a wonderful compliment. I think that that's my, training as an interpreter influencing me. So I owe a lot to my socialization with the deaf community. They've really impacted my thought process of how I provide care. So this is what else we'll be discussing tonight. You can read. So this is in summary, becoming a successful elderly person or older person. That means being healthy, which is positive. Having positive actions such as walking and being active, and also keeping your creativity and your cognitive agility as well. Take advantage of those things and try to involve them in your life. And really, that will make you healthy. One crucial thing for continuous good health is your eating habits. It is a challenge for me to talk to my patients because I myself am not an appropriate weight. I am categorized as obese by the national standard, quote unquote. Now, I don't like that, but what could I do? It's a challenge. I will admit it. It's a challenge to make these changes. So the national says about 1,800 calories daily is the suggested amount. Really, that's not too much. If you divide that between 3 meals every day, that is, let's see, 600. So 600 calories each meal. That's a fairly small portion. So the more fruits and vegetables, the less carbs, the less grains or starches a person eats, the less sugar. That can help your body and help you to be successfully stay within that calorie range daily. Protein, 5 ounces. So think about how much you eat. Like, for example, some chicken or steak. The serving size is usually about this big. Typically, you're supposed to reduce that a bit. The best comparison is that of your fist. The dimensions of your fist is not much meat. Or maybe you could think about a deck of cards. That is about 3 ounces. So, yeah. And drinks. Water is crucial. And things that are not sweet are typically better. Caffeine, like coffee, tea, things like that. Those things also affect your body to make it more dehydrated and pushes fluids out of your body, meaning that you may need to drink more water or perhaps Gatorade or another sports drink, you know, something that maybe doesn't include sugar, but you can drink to rehydrate. So salts, sugars, fats, the three of those really make a lot of food taste delicious. It's true. And those are also the worst things for our health. And it's a struggle to maintain a healthy weight if you indulge in those things. One thing I do want to warn you about, really, science has critically analyzed what it means to be a healthy weight. And we have lots of different research on that. For example, the BMI is more related to the heart risk compared to actual healthy weight. But BMI for men who are typically larger bodied and have more muscle mass may be similar to a woman who has a larger body mass, but may be healthier than another person. So it's really not a perfect system of measurement. And basically, this and many things I will discuss tonight are just trying to think of ways to incorporate balance. You know, maybe you can do some fun things that are less healthy, but eat a healthy meal and make sure to have balance in your lifestyle. Sleep. Sleep is so important. It's massively important. We really don't think about how important sleep is, but 7 to 9 hours of sleep per night. Studies say that that's most ideal for you to function. We do see people not sleeping well or people staying awake all night while working. It is more risky that you could get into a car accident or have other health problems later down the road. For example, breast cancer has been tied to people who are night owls and stay awake late into the evening. So it is a challenge, but also we have all experienced the draw of technology, and looking at the blue light all night can really affect and change your ability to sleep overnight as well. Also, as I just mentioned, coffee and caffeine, that could probably mess up your sleep cycle as well. So try the best you can to sleep 7, 8, 9 hours every night. You might notice there is an improvement in your functioning during the day and your mental capacity. Some research says that people who are older don't need to sleep as much, which may be true. But, however, it's not really a good excuse or reason to not sleep. If your body feels tired, then you probably need some sleep. And if you don't sleep, like, for example, you have trouble sleeping or you have racing thoughts, I would suggest meeting with somebody like a doctor who specializes in that, who can give you more of a detailed discussion on a course of treatment. And number 3. Being active. Exercising. It doesn't have to be formal exercise like joining a Zumba class or weightlifting at the gym. It could be mowing the lawn or walking the dog or walking with friends, cleaning the house vigorously, taking a few trips up and down the stairs. But it's important to take the time to get your heart working. It doesn't mean, yes, I walked around the house, or yeah, I walked from the car into the grocery store from here to here, maybe 5 parking spaces width or 6 parking spaces. I'm talking a brisk walk from one far distance to another, one that can really get you moving and get your blood flowing, and maybe even put you out of breath a little bit. You can have good 5-minute stints of it, and that can still have some really positive impacts on your health. If you just do short little 5-minute exercises, that can make a big difference. So total should be about 150 to 300 minutes of activity weekly. So let's say if you 5 days a week means about 30 minutes a day, or 60, somewhere in that range, 30 to an hour a day of exercise. And then 2 days a week, you should do something that really builds your muscles. Squats or other exercises. You can look online. There's really great Pilates exercises or other things that you can learn, like yoga, etc. Things that kind of force your body to build some of that muscle and work harder. And also that can help your body weight, or you use the weight of your body, excuse me, to keep yourself moving. And the benefits of exercise is to reduce anxiety, helps reduce depression and pain from things like arthritis. It can help control diabetes better and lower high blood pressure. And it also decreases your risk for heart attack or stroke. Number 4. It has 2 number 4s here. So first, I recommend going to see the doctor routinely. Doctor, midwife, nurse practitioner, physician's assistant could mean any medical provider. It's just important that they give you a quick check over, have a quick discussion with you, make sure that you've completed several screenings, tests, maybe blood work, gone for a mammogram. Those types of things are really important because that prevents you from it's disease prevention, or it helps us catch diseases and chronic illnesses early and then better provide treatment. So a person who was born with female organs should go to see a specialist, such as an OBGYN, once or twice a year. And that depends on if they're still menstruating. Maybe they would go more frequently. If they are menopausal, post-menopause, maybe they wouldn't need to go that often. And if a person depends on medications to prevent pregnancy, then they should go annually. You should also be seeing your regular doctor, your PCP, to get your cholesterol checked, to be screened for diabetes, get your weight checked, your blood pressure, those types of things. Also, they'll screen for depression and talk to you about a range of things. Your doctor could help you manage your medications so that you can maintain treatment for any health problems you may have. And once you've been diagnosed with something such as heart disease, they will ask you to go see specific specialist doctors to manage that disease. So you'll have a person who will help you manage each specific problem. And you should go to the dentist at least once a year as well, and go to get your eyes checked at least once a year as well. I also mentioned lab draws, blood draws, screening for depression. Obviously, depression doesn't come up in a blood draw, but those are things that you should expect to talk about with your doctor once you visit them.
Mammograms, they should be every 1 or 2 years, depending on the average risk for the person involved. You need to know your family background, If there's a concern, if there's something that you should be thinking about, then yes, you should make sure that you are getting your mammograms. Mammograms about the age of 40 to 75. Keep in mind that individuals who are healthy think, oh, I don't need to go for that, you know, but we still need to go. You still need to have the checkup. You need to have those taken care of. And maybe less after the age of 65, but that is something that we need to remember. Pap tests or pap smears. At the beginning, at the age maybe 21 to 65, a pap smear is not necessary after age 65 because the possibility of cancerous cells would be very slow growing, and there's less concern about that. So after the age of 65, it's not as necessary to have those checks as often as you are when you're a younger age. It's the same idea that when you're thinking about going to there has been research that has talked with individuals about going to see their doctors. And one of the key parts of that is checking with the pap smear to be able to see the reasoning for that is to prevent cancer. That's the most important part of it. Research has shown, as I was starting to say, that deaf women are less likely than hearing women to go get their screenings. There is a vaccination now for individuals to prevent cancer, and that age is preteens, 11 to 12 years old, can have the vaccination up to about age 45. That is something that is being done now that hasn't been done before, but that vaccination is to prevent cancer, and only that one cancer that we're talking about. Cervical cancer within your cervical spine, cervical area. The vaccination for that is for those three in that area. Your cervix, your anus, and your head and neck. All of those are similar types of cancers, so this vaccination is helping to prevent that. And again, that doesn't matter men or women. I encourage each of you to get the vaccination when you're younger. Girls or boys, both should be getting the vaccination to prevent any problems in the future. Screenings that are done, one of them is a colonoscopy. Screen for colon cancer. It is a diagnostic tool. They're able to see if there's any new cancer in there within your colon and your colon rectal. There's a new test that is being done that you can do at home, that you can turn in a sample of your bowel movements. You can turn it in. Then they can screen for colon cancer, which is very cool, something new that we're doing. So that's another screening that can be done with the doctor's office, but you should be screened every 1 to 10 years, depending on what you're doing and which screening you're using. There's a DEXA scan that is done about every 2 years. And this is for osteoporosis, or to see your bone structure, the weakness in your bones, if you have bone fragility, if you have compression in your spine. So the DEXA scan is something that checks specifically for the skeletal, the bone part of your body, to see if your bones have weakened. And if so, then your healthcare provider can give you medication to stabilize it so that it does not become worse as we go on. Okay, number 5. Medications. Medications as the doctor has ordered for you. Make sure you know your medications, know what the name of them are, know the reason you're taking your medication. You know, I've asked people, oh, so you're taking this medication, what are you taking it for? Oh, I don't know. So you should be able to explain to your doctor. It's very important for you to know, oh, this is the reason I'm taking that medication. You also need to know the dose, how many milligrams of that medication you're taking. How often do you take it? What is your schedule? Do you take it once a day, twice a day, only in the morning, only at night? These are things you should be aware of to be able to talk with your medical professional and have that information. If it's something that you can't memorize, then have it on paper so you can bring it with you. As I just said, medications are what the doctor's orders for you, but there are also supplements and vitamins and minerals that individuals take. It's very important for your physician to know that as well. The doctor has the information, of course, of the medication that they've given you. You let them know what the supplements are, and you need to make sure that there's nothing that is contraindicated or something that causes problems with those two things, the medications and the supplements, interacting with each other. Maybe the interaction is it causes your medicine not to be as strong as it should be, so it's not as effective, or the two of them together could cause more weight gain, could cause more weight loss. So you have to be very careful when you're taking supplements and you're taking medication at the same time, or just taking supplements. Make sure you talk with your doctor. So again, you need to be very careful with that. If you're taking a medication, such as an antibiotic, if you were prescribed that, I know you've heard this many, many, many times, take all of the doses, but it is very important to take all of them. You know, a lot of people take them and you're supposed to take them for 7 days, but after 5 days, I feel good, so I stopped taking it. You need to continue taking it to the end of the doses, to the end of the medication, because even though you're feeling better, that bug is still in your body. It hasn't gone away totally. And there's a chance that it could come back and resurface because it doesn't have the medication or the antibiotic fighting it. If there's a chance that there's a medication that you think, I just want to take that medicine anymore. Some people may think, oh, I'm just going to stop taking it, but I don't like the side effects of that medication, or I don't like what happens when I take it. You need to speak with your doctor beforehand. For example, some people say, oh, I take that medicine, it makes me very, very tired. Or I take that medicine and it makes me feel anxious. So they just stop taking it. Well, if you stop, it could be worse to make you feel worse, or it could make you feel better. But the point is that any changes with your medication, please talk to your medical provider. I encourage you to try and develop a true relationship with your physician where you can talk with them, your PCP, your nurse practitioner, whoever is your provider. Talk with them, have a conversation with them about you, about your health concerns, about your issues, your fears. I encourage you to find someone that you are very comfortable talking with. If that means bringing in an interpreter, or it means doing it in a Zoom call or whatever, but find a comfort level for yourself so that you can have those conversations with your medical provider. Mostly for the reason for that is so that your healthcare continues to be healthy for the rest of the time. Number 6. Doing things to preserve your health, to care for yourself. Vaccinations are very important. Sunscreen, anything to take care of your skin, very important. You do understand that your skin is the largest organ on your body, and the chances of cancer because of exposure to sun is very high. Having safe sex, making sure that you're aware of how to have safe sex. Maybe someone who's older, their partner is gone, and they meet someone new, and they think, oh, I don't have to worry about getting pregnant. I can just do whatever I want. I'm postmenopausal. But there are still diseases that are passed to each other, through each other, HIV, gonorrhea, chlamydia. So we need to make sure that when you are having sex, at no matter what age, that it's safe sex. Make sure that there are blood tests and screening to make sure that you are still healthy. Number 7. It's understandable that people enjoy having a drink, but understanding also that maybe no more than 3 drinks a week, a day, 3 drinks a day, up to 7 a week. That's the healthy moderation. It is keeping you healthy. It's keeping you being considerate of your health. Also, remember, there are some medications that cannot be taken with alcohol. So if you take alcohol, if you're drinking alcohol and taking medication, the chances of getting very ill, the chances of having a reaction such as fatigue or drowsiness or other things that are not compatible to the two of them being together, you need to be aware of that and know your medication. The next thing with nicotine, with vaping, with smoking, tobacco is not healthy for your lungs. We all know that. There's an increase of the possibility of lung cancer, as well as other problems, other cancers that can be caused because of engaging in acts using nicotine or vaping. Marijuana. Well, it's interesting right now, the data that is out there with marijuana. You know, there are some research that says, oh, there are benefits to marijuana. There are other researchers that says, no, it's not good for you and it could affect your health. So really, we're talking about the same that we're talking about with drinking alcohol or smoking or marijuana. Be considerate. Think about your limitations. Be wise when you're consuming that. If you're using it, make sure that you're not overindulging. Make sure you're not using it as a long-term, because that long-term use could really affect your physical health, your mental health. If you are drinking every day, if you're smoking marijuana every day, it will catch up. There are things that could happen that will impact your physical health, your mental health. If you're smoking or using vaping every day, again, that will impact your health. And it's something to remember that we should think about in moderation. Number 8. Okay, a healthy body also helps when you have a healthy mind as well. We do know that over time, some brain functions decline. Of course, we know that. But some do not decline. Some of your functions are just steady and keep going. But to be able to keep that and to make sure that you're still keeping your brain agile, there are ways to do that. Be active, join things, join groups, join clubs, maybe a reading club or a book club. Some sort of activity. Maybe get involved in going out to dinner with friends even, and having talks and conversations, just being active and doing things. Doing something that you're learning something. Go out for a walk, go out and do things. You can learn a new language. You could learn, if you're hearing, you could learn how to sign. If you use ASL, you could learn another language. But it's the opportunity to keep your brain moving and active. Another way that keeps your brain moving is puzzles and games. Find a new hobby as you get older. Find something that you enjoy, that you've thought, oh, you know what? This is something I hadn't done before. Maybe I'd like to try it. You know, this is something that is a new venture. It's something fun to do. Grab the opportunity. Find something that challenges your brain and start doing that, because anything you do that challenges your brain as you get older and keeps it agile and functioning and doing things means that your brain is working and you will be have a healthy mental capacity as well as a healthy body. Number 9 is very quickly, we'd like to talk about that. It's as people age, there are more physical challenges. We all know that. Arthritis, broken bones, maybe some mobility issues, maybe some problems with your heart, with your cardiovascular. There are things you can do to make your home more safe. You know, when you have rugs on the floor, we know that, you know, on the floor there are, you don't want this shiny thing, you don't want the floors, but it could be slick, but also understand that when you put a rug down, it could move on you. So make sure that it's attached and will not slip out from underneath. Maybe try making sure that you have it taped down. If your house has stairs, you need to be careful on the stairs, making sure that you have the right grips to be able to go up and down the stairs. As we get older, our eyes don't work as well as they used to. So we need to make sure that the lighting in our house is a little stronger, a little more than it was before. Going back to talking about bars and supports in your bathroom, there are support bars that you can put in there. They're available all over the place. And, you know, there was these old function ones that looked so ugly that, you know, they didn't look so nice. But now with the technology and the designs that are out there now, you can have those bars and supports in your house that look very nice and they fit in with your decor of your house. So that's something to reduce any injury, the chances of falling or the chances of something else happening. And last on this list, it says pets. Again, we're talking about keeping your health safe, and we're also talking about you having stimulus and doing something and having something to do. Having a pet is great. Having a cat to hang out with, having a dog to go out walking is wonderful. But they're also animals that are down low near your legs, easy to trip, easy to fall. You need to make sure that you're aware of where your pets are. They need to be trained well to make sure that your risk of falling is less. So make sure that your house is safe, not only just for you, but making sure that your pets are safe for you as well.
And also making connections. It has been researched that this is very important to have a community and have a network of people that you can depend on, especially during the pandemic. A lot of people were closed away in their homes, but fortunately, a lot of deaf people were able to use video phones to talk with their friends and family and maintain those connections. So we should keep doing that. Connect with people over Zoom or other ways of technology. It's really important to keep those friendships. And if you're getting together in small groups or maybe chatting with people, the sense of touch and maybe hugging your best friend is really important too. So feel free to reach out and maintain that network because it really will help you have a healthy life. It's funny. Many people think that that doesn't affect your health, but there has been several studies that find that having a good community and connection is important. Having a place to go, having people who can depend on me to show up or who expect me to show up or hope that I'll show up, that'll really help have a better impact on your mental health when it is in regards to depression and anxiety. And the last one, a little added bonus for you, sexual health. So I know that maybe you're not trying to make a baby, but you can still engage in sex. And it's very important for your brain. Women and people who have uteruses, they maybe have hormonal effects where in their brains, they have many things that they want to do. So maybe they're not thinking about sex. Perhaps they're very stressed. They've had a fight with somebody, or they don't want to be involved with a person anymore. And people who have testosterone are very different. Testosterone functions very differently in the bodies, like animals. I don't mean to say like that, but their sex drive is very different than people who don't have testosterone in their bodies who are born with female organs. And so later in life, your needs, your desires, your wants, they can change for sure. And if you have a partner, it's important to discuss with them what's my preference and what's yours, etc., and then find a way to come to an agreement. Maybe sex takes longer. Maybe you need more of a warm-up time. Maybe you need more, more touch and play before actually having sex. And it is important that it is kind of like a use it or lose it situation, because the vagina can become less soft, less flexible, and less elastic if it isn't used. So go ahead and use it. And orgasms are really good for you as well. It doesn't have to be sex with a person. It could also be self-stimulation and self-pleasure. That's really healthy as well, and it's a healthy thing to continue during your life. It helps reduce blood pressure. Orgasms can help reduce blood pressure, as well as when you orgasm, it uses many muscles in your body and can affect your positive endorphins. And so, that being all, I hope that you have questions for me. I'm looking forward to them.
Okay, we will begin our Q&A. So if you have any questions, please feel free to use the Q&A box down below, and we will address them. The first question we have is, do I need a flu shot and a booster for the pneumococcal vaccine?
It depends on your age, first of all. The flu is an annual vaccine, which means that there is a new medication that is administered every year. And the pneumonia vaccine needs 2 shots to complete the vaccination after the age of 64. So the first and second shot are, I believe it's 6 to 8 months between them, up to a year, I think is the longest. But do you need a booster? That's a good question. I would suggest talking to your doctor or your provider about that, or perhaps a pharmacist. They can give you a better answer. One additional precaution is the COVID vaccine. I do encourage the COVID vaccine. And if you haven't gotten the COVID vaccine yet, I do highly encourage that. The new booster that was just became available, it's more specialized to the current variant of the virus that is spreading. And there are a lot of benefits from getting that vaccine.
Thank you. The next question is, what should I be looking for / aware of when conducting a breast self-exam?
That's an interesting discussion. There's actually a lot of opinions going around in the medical community right now about breast self-exams. There are pros and cons to self-exams. Some people who perform the exam and feel something they feel may be abnormal, they rush to the doctor and they demand a bunch of tests. And then that stress is a negative influence on their health because they're very stressed. Some people do actually find lumps in their breasts for sure, which is very important that we catch those early. So for me, what I tell most of my patients is just be aware. Just know what your breasts feel like on a normal day. Know what they look like on a normal day. When you look into the mirror and you raise your arms above you, their fullness should be about the same. There shouldn't be any bulges or large spots or anything that wasn't in the area before. So those things, if you see those kinds of abnormalities, it is a good reason to go and speak to your doctor.
All right, the next question we have is a bit long. I've read a lot about inflammation and the benefits of taking supplements like omega-3, turmeric, ginger, and CoQ10 to help combat inflammation. Do you think these supplements do any good? And what do you recommend to combat inflammation at an older age?
That is a challenging question. Inflammation comes with many different things. Pain, allergic responses, exercise even, disease, illness. All those things can cause your body to have a reaction of inflammation. Taking different supplements maybe has some benefits, but the research on it is a little hazy. Each company who produces those multivitamins, they have their own dosages. They're very inconsistent, and they don't have one agreed upon, researched, verified dosage that proves, yes, this medication or this over-the-counter vitamin helps you to prevent inflammation. I hate to say it, but there is a phrase that says you're spending a lot of money on something that just ends up in the toilet. Really, the most important thing is that you're eating healthy, that you're exercising, and also talking with your doctor or your provider. They may ask you to take different supplements and vitamins, but the things that are researched and actually validated, they often say that they need a very large dosage to have the very good benefits of reducing inflammation, something that you wouldn't be able to take on a daily basis, something that would require many, many pills a day as opposed to just one. So the other challenge is, if you believe something benefits you and makes you feel better, then maybe it does help you. And if your doctor tells you that you should take this every day, this medication is important to take, and you don't believe them, maybe you feel like you aren't getting any benefit from the medication. That may be because your mind isn't really into the idea of taking it. Mental influence is very strong. It affects your entire body as well as your mental health. So having trust in the medications and your provider is really important. So just be careful. And when you read things online, if it says something like .com, remember that means that their goal is to sell something and earn money. So keep that in mind.
The next question we have is about the shingles vaccine. Is it important to get the shingles vaccine, and at what age?
Yes, yes. The vaccine for shingles, the Shingrix vaccine, is very important. I have to go back to my slides. Let me look here, because I don't give that vaccine very often, but the age is 60. So above the age of 60, we recommend that you get vaccinated for shingles. Most people under, I would say, 40 get have gotten the vaccine that prevents chickenpox. And the chickenpox vaccine and the shingles vaccine are very similar. It's almost like a booster for the chickenpox virus, because it is the same virus that causes shingles later in life. So I definitely do encourage that vaccine for people who are over the age of 60, and that's a one-time dose. That's all.
Great. The next question is, how can I protect my bones and joints as I age?
First, exercise. Weight bearing, quote unquote, exercises like squats or moving around, walking, things like that, that put pressure on your bones. They actually cause the bones to have a chemical reaction internally that triggers more bone growth and more strengthening of the bones and provides a better bone structure. So being active, moving, jogging, doing activities around the house, that's number one. Number two, I would recommend calcium and vitamin D. Many of us live in the northern part of the country, and it is true that we're all vitamin D deficient. We don't get enough sun up here in the Northeast. So go ahead and talk to your doctor about getting a lab draw to see your vitamin D levels and see if you should be taking vitamin D supplements. That is one supplement that I do strongly encourage because it has been researched and proven that vitamin D does help your body improve your mood as well as improve your bone strength. And we also, it helps you use calcium well. Women in general, I do believe it's 1,000 milligrams of calcium every day. I should know that. I think it's somewhere between 1 to 2,000, but that's not something I advise on every day. But yes, women can use calcium supplements or eat dairy or other things that have a lot of calcium in them. Also, leafy greens as well have calcium in them, so I recommend a lot of those as well.
Great. The next question is, should I be taking a baby aspirin a day when I get older?
Oh, that is a very good question. So it seems to me, while I look into research in the medical community and their discussions, that having a 81 milligram tablet of aspirin a day is something that everyone could benefit from. It seems like there are very few side effects from taking that. It can help you reduce your risk for heart problems. And if you've been diagnosed with a heart problem, you should take it. If you haven't been diagnosed with a heart problem, or you don't have any other risks, or you do have any other risks, excuse me, like high cholesterol or things like that, I would recommend taking one, but it would be something you would need to talk with your doctor about and get their agreement and their approval to go ahead and start taking that. Most likely it is something that could help everybody. I can't say with 100% certainty, but most people can benefit from that. And aspirin is something that we give people who are pregnant as well. So because the research has found that there are benefits on the heart and cardiovascular health and system, it helps to build blood vessels in the placenta. So that is a similar function in your body to when you're aging. It helps support your blood vessels that are all over your body and continue to keep them healthy.
And a follow-up on that question, if someone is allergic to aspirin, is there a substitute for baby aspirin?
I don't know if about an allergy to aspirin. Your doctor, and perhaps they told you you shouldn't take it. Like if you're having a problem with ulcers, or you'll be having a surgery soon. I don't know of any exact substitute. There hasn't been enough research done to really solidify any evidence of another medication being equivalent to aspirin. But if you're allergic, I would say you probably shouldn't. There may not be a substitute. but perhaps you want to do other things to improve your health, such as exercise, eat well, maintain a healthy lifestyle, things like that, to kind of compensate, to reduce your need for the baby aspirin daily.
Gotcha. And the last question of tonight is going to be, how do I know if I should be getting an ultrasound along with my yearly mammogram?
Oh, that's a good question. So most people, when they go for their mammogram, they will have a doctor sort of behind the scenes in the office who is quote unquote reading their mammogram once it's finished. They will kind of, clear it and things like that. And that person will tell you, oh, we would like to do an ultrasound, or perhaps your screening came back clear and you don't need an ultrasound. So mammograms help us kind of find dense breast tissue. And then if that is found, they would recommend a ultrasound yearly, which is something you should talk to your provider about. If you've had that procedure done several times, you can request that you have both a mammogram and an ultrasound, but it depends on your background. Some people also substitute the specific MRI on the breast tissue as well, but it really does depend on your health history and your conditions that you may be diagnosed with and your risk as well.
Gotcha. Okay, well, that is going to conclude our Deaf Health Talk for this evening. Thank you so much to our presenter, Kim, as well as our interpreters, our captionist, Kate, Pavani, Bettina, our tech team, and everyone else who is in the backgrounds helping us put on these Deaf Health Talks each month. Our next Deaf Health Talk will not be until next year. However, I do want to tell everyone who's attended today about an upcoming event in November, the virtual health fair being put on. It's going to be completely virtual online on November 12th from 10 a.m. to 2 p.m. And it's completely free to attend. I'll put the registration link in the chat below. And if you would like to attend, feel free to check out that link and sign up. And if you sign up soon, you'll be receiving a goodie bag in the mail. If you have any questions, please feel free to reach out through our social media. I'm happy to respond. This recording will go up on our website and onto our YouTube page in about a week. And with that, I will say good night, everybody. Have a great night.
Thank you all. I appreciate you inviting me, and I hope that everyone here benefited. Take care. And thank you, interpreters and captionists as well.